All right, welcome back, everybody. My name is Dr. Khan Kao, and welcome to the channel again. Today, I am joined by my good friend, Dr. Ngoc Pham, or Pham in English. Uh, we went on a trip together, unexpectedly met during med school in Vietnam, and then ever since, we've been in connection with each other. She'll be talking to us about radiation oncology, or Rad Onc for short. So welcome now.
All right, thank you, Dr. Kao, for inviting me to speak on your channel. I think this is going to be very beneficial for the medical students and the rising residents because when we choose our career or specialties that we're going to be practicing for the rest of our lives, right?
Yeah,
A lot of us don't know what all the options are, including myself. When I
yeah,
choose my specialty, like I have no idea what I want to do.
yeah.
And I probably changed my mind like a million times before I decided on radiation oncology. And we have known each other for what kind? Almost 7 years.
Yeah, at least, yeah.
Yes, I know time flies, and you guys, this guy is the most amazing guy. I mean, he know how to work hard and he know how to play hard, and that is very important for our career because you know how
Yeah,
stressful our jobs are, and you
yeah,
have to know how to enjoy life and relax. Otherwise, our job can be very, very stressful.
yeah,
And thank you,
yeah.
Con, for the invitation, and I'm very excited to be here today.
Yeah, I appreciate you. You're a super busy person, so I definitely appreciate you coming and joining me on this channel. And I mean, I think you're a great person to talk about radon. You enjoy your job, and I'll be honest, radon was never on my radar. But but the more I talk to you about it, I was like, heck, that sounds like something I could have done.
Honestly, I did not know about radiation until probably at the very end of my third year. Because as
Yeah,
you may know, radiation is very specialized and is a very small field.
yeah,
In the whole nation, there are probably 200 positions a
yeah,
year.
yeah, yeah,
So, especially where I went to school, UT Houston, University of Texas Houston branch,
uh-huh, yeah,
we don't have a radiation center.
yeah,
So, I did not know about radiation
yeah,
until I do an away rotation at MD Anderson. And it
yeah.
was very coincidental. I was actually on a psychiatry rotation.
Oh.
And yes, and a lot of cancer patients actually has depression, right?
Hmm.
Especially at Anderson, a lot of these guys are like big guys, did very well throughout their
Yeah,
life, and
yeah,
now they have cancer. They felt they're handicapped.
yeah.
They cannot control their life, so they have a lot of anxiety and depression, and that's the reason why I did the psychiatry rotation there, and that's when I learned about radiation oncology actually.
Okay. All right. Yeah. So can you briefly describe to us your path in choosing radon, and also a brief description of what exactly radiation oncology does?
Yeah, yeah. So just like what I say, I did not know about radiation, but one thing that I kind of glad that I did and kind of arrogantly um, um, show through my education is that I had a good CV,
Yeah.
to start out with.
Hmm.
Okay, a good step one score is very, very important, which I had, and I had a lot of research background. I
Hmm.
started that since undergrads, and
Yeah.
both of that component is very, very important when I apply for radiation oncology. Initially I went all the way from radiology to jitter surgery to dermatology because of my background of how good it is, right?
Yeah.
And I was like, hi, I have it. Why don't I try for a more competitive specialty, see how it goes?
Hmm.
Until I did my rotation at MD Anderson, and a lot of my the students who rotate through that rotation was from Baylor College of Medicine, where I did my
Yeah.
residency.
Hmm.
And actually, a lot of them took a year off to do research to prepare for the radiation residency application.
Mm.
And I'm like, this field is quite interesting, quite competitive. And it has the requirement is basically what I have, right? A good score and a good background in research.
Mm-hmm.
And so I wanted to challenge myself actually
Mm-hmm.
um, in applying when I applied for the field. So I got accepted into Baylor College of Medicine to do my residency training, and I felt very fortunate because it is where Baylor is where Houston is where I'm from, where all
Mm-hmm.
my family are, and
Mm-hmm.
it's my top choice. It is quite stressful, to be honest, during the match process.
Mm-hmm.
So a little bit background on what radiation oncology is.
Mm-hmm.
So for cancer care, there are three ways for us to treat it, right?
Mm-hmm.
One is to remove it, surgery. The second one is chemotherapy, and those two are the ones that people are most familiar with. And the third one is radiation therapy. So basically, what we use is that we use high energy X-ray to kill the cancer cells, and the machine is it's almost like a giant CT scanner.
Mm-hmm.
Okay, so non-invasive treatment, very well tolerated. Actually, there are some cancers that historically was treated by surgery, such as stage 1 lung cancer or prostate cancer.
Mm-hmm.
Nowadays, um, because radiation, the toxicity profile is so low and the
Mm-hmm.
outcome is very comparable to surgery, radiation nowadays has replaced surgery to be the
Mm-hmm.
primary treatment for those type of cancers. So quite very interesting. And and it's so very well tolerated because it's a non-invasive treatment. So for the older patients, like the oldest patient I treated, he was 98 years old.
Oh, wow.
And he flew through the radiation treatment super well. And
Mm-hmm.
he has a really bad cancer, esophageal cancer. So quite interesting field.
One thing I did want to ask you, I mean, you have a competitive CV. What made you decide Rad Onc versus dermatology or ophthalmology?
So dermatology and ophthalmology are like a um, what do you call it?
Like a surgical.
Like a surgical specialty.
Mm-hmm.
And I think I had a really bad experience with one of my surgery rotation. It
Mm-hmm.
was a pediatric rotation, and there were only two fellows in the whole hospital, and they were on call Q 36 hours. So the two guys, right,
Mm-hmm.
take turn to be on call, and there, oh my gosh, it was a very difficult rotation,
Mm-hmm.
and I think that kind of turned me down about surgery. Um, and like I tell you, the lifestyle, the salary,
Mm-hmm.
right? Um, is pretty appetizing in radiation.
Mm-hmm.
Um, and also, I like a mixture of my job, like when I can be able to see patients, have some time to myself in my office, do notes and contour, design radiation field,
Mm-hmm.
and go to the OR. I don't think there's many specialties that can have a mixture of all of that.
Okay. Yeah. That's a great way to process your decision. Cool. So you talked about the training path. How long does it take? Is it 4-year program with like a year or 5 years? Sorry.
Yeah. So it's 1 year of preliminary or transitional year
Mm-hmm.
plus 4 years of radiation. So a total of 5.
Mm-hmm. Okay.
Yeah.
All right. And then are there any fellowships that you do afterward, or you just go straight out and become a Rad Onc?
Yeah, so most radiation oncologists out there are just general radiation oncologists because we are already
Mm-hmm.
very specialized.
Yeah.
But there are people who want to treat, for example, kids only
Mm-hmm.
or lung cancer only. There are fellowship programs out there, but they
Okay.
are not ACGME certified.
Okay.
Okay.
Yeah.
But then if you want to subspecialize like that,
Mm-hmm.
then you have to practice in a big cancer center,
Mm-hmm.
like MD Anderson, like
Mm-hmm.
UCLA, UT Southwestern.
Yeah.
Because if you're in a smaller centers or in a community practice, you don't have enough volume to support your practice, basically.
Okay. Okay. All right. So, you work in a private setting currently. When you made the decision between academic versus private, what was going through your head in that respect?
Right. Yeah. So I was fortunate that when I finished my residency training, I have quite a few job offers.
Mm-hmm.
One of it was from my department chair from my home program to offer me a job to stay on as faculty, and
Mm-hmm.
the other three offers were private practice. It was a very rough decision, to be honest
Yeah.
with you. I had to consult. I mean, I was stressed out, like totally stressed out.
Yeah.
I spoke to a lot of people, both in my attendings and the private guys I know,
Yeah.
and even that. I mean, I'm like, I don't know what to do, right?
Yeah.
So in I think when we're in school and
Mm-hmm.
as a resident, we have been brainwashed that you always stay in academic, never go out.
Yeah.
That's a really bad thing to go out
Yeah.
because you want to contribute to the scientific world, to observe and publish and do research and all of
Yeah.
that, right?
Yeah.
So that's one thing that I felt very guilty when I exit the academic world.
Yeah.
But I was this close to signing with the academic contract.
Mm-hmm.
But my private contract, my private offer came in a few weeks earlier than my academic, and at that point, I'm just so tired of thinking. I'm just like, hell with
Yeah.
this. I'm signed, right?
Yeah.
Like 2.5 years later. And am I happy? Yes, I'm very happy. I am very happy that I make that decision because in private I have a lot of autonomy. And Kanye, my friend, so I have two
Yeah.
kids, and the
Yeah.
most recent one, she just turned 7 months old. So as a mom, you know, I need a schedule that is more flexible, so I
Mm-hmm.
can care for my kids and my family as well. In the academic world, so when I graduate, my chairman was so sweet. He just let me do whatever I want.
Mm-hmm.
So I can either do 50% clinical research. I'm sorry, 50% translational research, which is molecular biology, and 50% clinics, or I can do pure clinical, 100% clinical.
Mm-hmm.
Um, but in the if I mean, I already have my mind, I make up my mind. If I stay in academic, I'm gonna do full-blown academic, meaning research, right? Research based.
Mm-hmm.
And after 10 years of being in research, I just wanted a break at
Yeah.
that point. Yeah.
Yeah.
It's very time consuming, and you have to be very involved. You have to be very committed to your career.
Yeah, I still remember the conversation we had of you asking me regarding academics versus private. I was like, I have no idea. I'm only in the private world, but hopefully, I mean, you seem to enjoy the decision you made.
Yes, I certainly do.
Yeah. So, from the students aspect, pre-med and medical students, in choosing Rad Onc, what do you think are the qualities that makes for a successful Rad Onc?
Okay, so you have to have, let's talk about the resume first,
Yeah.
because you have to have a good resume to
Mm-hmm.
apply.
Mm-hmm.
Otherwise, you may have all the traits for a good Rad Onc, but
Yeah.
if you don't have the resume, you're not going to get into the program.
Yep.
So you have to like research. Okay,
Mm-hmm.
about a third of all the radiation oncologists are actually MD, PhD.
Yeah.
And the other third probably took a year off to do research
Mm-hmm.
to prepare for their application. And even even after you finish with medical school, it does not finish. You continue research during residency, right? And then so you have to have like research to
Yeah.
prepare for the field.
Mm-hmm.
The second thing is the score, right? You have to perform well. But the most important thing is that you have to be able to handle the stress, the end of life discussion with the patient. We are treating cancer, right?
Mm-hmm.
So some of the cancer are end stage,
Mm-hmm.
and you have to be able to counsel them, you know, what will happen. Eventually the cancer will explode and the patient will give up, succumb to the cancer. And you have to be able to have that discussion with the family and the patient. A lot of patience is very important.
Mm-hmm.
Um, and not only that, I see, oncology is really more of a passion rather than a profession. And I think all the other field as well. But,
Mm-hmm.
you have to be able to like what you do because you deal with a lot of stress, anxiety. The patients, when they are diagnosed with cancer, the first thing they will do is break down, right? They have a lot of them have depression, anxiety on top of that.
Mm-hmm.
So you be able to have to counsel them and take them through the process. And a lot of them were not, they were so upset that they don't want treatment, and you
Mm-hmm.
have to know how to handle it. And I guess that is the component. You have to be able to counsel the patients and walk them through the whole path. Not only the treatment is very easy. You go through school and you know what to do, but then how to handle the case, how to walk the patient from the diagnosis to cure. If
Mm-hmm.
not cure, then hospice, and what after that, it is more important as a successful physician.
Mm. Yeah, thank you for that. A lot of times it's not the medicine, it's how to communicate with the patients in these respect that and help them make the decisions that are important. And so thank you for that. So my next question is, what do you like most about Rad Onc, and or do you find exciting about it?
I know. So, when my family members or when a lot of my friends look at me, they're like, oh, are you choosing pediatric? Are you
Yeah,
choosing, OBGYN?
yeah,
Because I'm very small built and I'm a female, right?
yeah.
But when I told them, oncology, they're like, seriously, why such a depressing specialty?
Mm-hmm.
Honestly, to me, it's not. It's really rewarding to be a oncologist, because even for cancer, now because of screening, because of of our healthcare system and how aggressive we treat on cancers, the outcome for most cancer nowadays are very, very good. Very
Mm-hmm.
good. Okay, most cancer can be cured. Okay, so go to see your doctors, go get your screenings and the things. But even if the cancer is not curable, even the cancer has spread and caused pain, let's say, for a patient, patient is so committed to their treatment. Okay,
Mm-hmm.
so like for example, radiation therapy is very commonly used to control pain secondary to cancer. So I remember two of my patients came in paralyzed from a tumor spread to the spinal cord compression, right?
Mm-hmm.
And then I treat them with 10 treatments of radiation, see them for follow-up 1 or 2 months later, and they off their stretcher walking.
Wow.
From that, the excitement, it's just so rewarding to see them, doing well, although the cancer is not curable. Okay, but
Mm-hmm.
the very end of their life, the whatever days that they have left, we be able to bring the quality of life back to them. And at that point, quantity is no longer matters.
Mm-hmm.
um, and for the patients who are curable, we celebrate their remission with them, right?
Mm-hmm.
So normally in my clinic, I have like a little poem that I let the patient read. So basically it's like, my course have run and now I'm on my way, goodbye to cancer, or wherever. And there's a bell that they ring 3 times, and they're like, a lot of people in break out in tears when they read a poem and ring a bell, because how what they have went through, and this is the end of the tunnel. And I have like big guys, right, and they
Mm-hmm.
just break out in tears when they finish the cancer treatment. So I felt like the celebration of life again, right, or the quality of life is is very rewarding to me.
Mm-hmm. On the other end of the spectrum, what do you dislike about Rad Onc?
Yeah, this is one question that I kind of have to think about a lot.
Yeah.
But I guess one thing that I don't like about radiation, I guess I have to come up with one, right?
So
I
that
guess,
way, so this way, you know, what I mean, a student would know what they're
yeah,
going to get into or
yeah.
have to deal with.
All right, fine. If I have to come up with one, so you know, radiation is delivered through a machine.
Hmm.
So machines sometimes break down.
Yeah.
So I have to stay late, and sometimes it's like 10 p.m.
Uh-huh.
For all the patients to finish their treatment before I can go home,
Yeah.
right? And spinal cord compression, sometimes it's like Christmas Eve, and there's a spinal cord compression guy that's like emergent indication for radiation treatment have to come in.
Yeah.
But how often does it happen? Not very often at all.
Mm-hmm.
Like I'm the only radiation oncologist in this hospital I'm working at, and so that means that I'm on call 24/7. And
Mm.
let's see, in the last year, I probably get called on the weekend or a holiday, probably like 2 or 3 times.
Okay.
Compared to ED or surgery, I think that's a pretty good life.
Yeah. Yeah. That is very good. So be aware that you might be called in for or things breaking down. Uh,
Right. Yeah.
Fair enough. Fair enough. So let's see. Um, so you talked about the schedule and whatnot. How has it shaped your work-life balance? Um,
Um, if I tell you one of the reason why I choose radiation is because of its schedule,
mhm.
I would not lie to you. Okay.
Yeah. Yeah.
So the life of radiation oncologist is actually pretty cush.
Yeah.
And the four specialties that's cush, roads, right? ROAD,
Sure.
radiation, radiology,
Hmm.
ophthalmology, anesthesia, and dermatology, right?
Hmm.
So radiation is one of it.
Yeah.
So I mean, the schedule is pretty good, to be honest. I mean, if not knock on wood, if there is no emergency or the machine runs well,
Hmm.
then as a private physicians, I really consolidate my schedule so that I finish everything in half a day. So
Oh
I
wow.
open early. I open from 7 a.m. and I usually finish all my patients around 1, 2-ish. And but there are times when I'm more busy. I open until 3 or 4, but then that means I switch off my clinic in the first half of the day. So the
Hmm.
second half I can do notes, documents. I design radiation field. I review images and
Hmm.
catch on the other stuff.
Okay.
And and that can take a good amount of my time.
Okay. So it sounds like a 9 to 5 kind of job, weekdays.
It can be. Mhm.
Okay. And lots of flexibility and be able to do what you want with your schedule. Sounds
Absolutely.
sounds very nice. Um, uh,
For sure.
yeah.
My husband
Well.
is very happy.
Yeah. Yeah. Oh, by the way, tell him I say hi.
I sure will.
So what's has changed over the years in Radonc and also in light of COVID-19, and if you can discuss what you think uh, any changes 10 to 20 years from now.
Yeah. So I think the biggest change in radiation is the paying model. Okay,
Hmm.
before we can just bill wherever and treat wherever because nobody knows about radiation. We can do whatever we want.
Hmm.
But because oncology or cancer care is is so expensive. Then the insurance companies, Medicare, Medicaid is tightened up. Actually, this year, not this year, 2021, they
Mm-hmm.
roll out a new radiation oncology model.
Yeah.
And that kind of changed away a lot of things that we practice. So basically, they try to make radiation more hypofractionated, meaning treatment should be done faster. Like for example, right, breast cancer previously, the female has to take 6 weeks of radiation. Nowadays, they do 4 weeks of radiation. Similarly, for prostate cancer, previously they do 8 to 9 weeks of radiation. Now they can do like 6 weeks of radiation. Now, not all the changes are bad. Some of the changes are good, and I am all for it. But sometimes there are things that we feel like is beneficial for the patient, but we have to go through a lot of loopholes, fighting with the insurance companies to be able to get the treatment approved for the patient. And that's one thing. And 2021 will be a big year for us because the Medicare rolled out a new radiation model. In terms of COVID-19, oh gosh, no. Luckily, the good thing is that, or good thing, the bad thing is that cancer does not stop, right? Cancer continues on. And they don't know we're in the pandemic. Honestly, for the last month, I see more advanced cancer than usual, because the patients cannot get the screening, the treatment that they need on a timely manner. I'm not sure you've read on the news that this lady who was diagnosed with, was it stage 1 breast cancer, but because she couldn't get her surgery on time, she, metastasized. She became stage 4 cancer. So, the pandemic, that one way that kind of affect our treatment. We have to be creative, because the patient's afraid to come to treatment because of exposure, and also they cannot get the treatment that usually they would need. And also telemedicine, right? I think even after, the pandemic stop, telemedicine will play an important part of how we see our patients because of the convenience, right? And for the patient, especially for cancer patients, some of them are very ill to come to clinic, and it's more economical for the insurance company too, I think.
Okay, thanks for that. I appreciate that. And then what do you think the job market will be in Rad Onc for the current pre-med and medical students?
Yeah, well, cancer rates is going up, not down. So the previous statistics says that 1 in every 8 women will get breast cancer, but because of screening, because of mammogram, I feel like the next time they release the statistics, 1 in 4 of us will get breast cancer, but we catch the cancer in much earlier stage. Okay, so I think cancer care will always in need, especially the baby bloomers. They get older, and the old ages increased risk of having cancer. So I think the need for radiation colleges are there. However, jobs are competitive in big cities. Houston, LA, Florida, New York. If you want to live in big cities like that, it can be quite stressful to find jobs. And actually, that's what I went through, right? For both for residency matching and for jobs, because I'm tied. Both mine and my husband's family are here. Everybody are here, and we're from Houston. So we want to stay, but because Houston is a big city, guys who graduated a while ago and couldn't find jobs in Houston and had to go away for work, and they continuously looking for opportunity to come back to Houston, and we're competing against those guys as well. Not only the new residents. So it can be very, very stressful for people who are less flexible and need to be in a certain geographic area for job or residency. But in the small cities, in the suburbs, there you can find jobs and high-paying jobs,
Mm-hmm.
kind of like, I mean, like double or triple my starting salaries. And
Yeah.
I'm like, craziness, it was so tempting to accept those jobs, but I don't think I cannot picture myself in a smaller city. It's just because of family and whatnot. But to answer your question, jobs are there.
Mm-hmm.
It's just if you're tied to certain geographic area, like big city is maybe a little bit more challenging to find it.
Yeah, I totally understand that. It's similar in my specialty, emergency medicine as well, where it's very saturated in the big cities, especially Houston. Good luck
Yeah.
finding a job
I
there.
mean, there's like an urgent care like every stop sign, right?
Yeah, yeah.
Yes.
All right. So if a student want to learn more about radon, where can they find additional resource for this?
So I feel like radiation, you have to have hand-on experience.
Mm-hmm.
You cannot just read about it. It's not the same. You have to shadow a radiation oncologist,
Mm-hmm.
visit a cancer center, you know, talk to the cancer patients to see if that is the stress that you can handle.
Mm-hmm.
And also what is exactly radiation. Even when I talk to my colleague and I talk to my patients, they have no idea what radiation is.
Yeah.
They think they're gonna glow in the dark. They can throw spider webs, they can, I don't know, be radioactive around the kids, things like that. No, that's not what radiation is. Therapeutic radiation is very, very different, very well tolerated. Um, and only a hand-on experience will take you there. So for students who are interested, you have to shadow a radiation oncologist to be able to determine if this is really for you or not.
Okay, I appreciate that. And then my last question is, do you have a number one tip for students in general in medicine or wanting to go into radonc?
Yeah, so I think I say it right.
Yeah.
The CV is very, very important.
Mm-hmm.
So start research early. It will never let you down. No
Mm-hmm.
matter what field you choose, even internal medicine, if you have a good research background, if you have a good CV, you will get into any program that you want. Okay.
Mm.
Now, if you decide later on that you want to go into a more competitive field, not only radiation, plastics, dermatology, what the EM, right? There
Mm-hmm.
are some programs in emergency medicine that's very competitive.
Mm-hmm.
Um, you need a good research background and a good step one, step two scores in order to match.
Yeah.
That's my number one tips for the students.
Okay, definitely appreciate that tip. I'm not sure if you're aware, but they're making step one in a couple years pass fail.
Oh,
Yeah,
great. I
yeah,
did
yeah,
not know that. Damn
yeah.
it. We're only, what, 10 years late?
But yeah, I think research will be more significant in trying to figure out what candidates to interview for
Right.
residency spots.
Yeah. And it can be any research It can
Hmm.
be, if you do molecular biology, great, but you don't
Yeah.
have to. Molecular biology is very time consuming, it can consume you easily. You
Hmm.
can do like observational studies, case studies,
Yeah.
anything. Just look for a PI and say, I want to do research, period.
Yeah.
And just you would not fail with that.
Yeah. Yeah. Cool. All right, I'm gonna end it. Thank you, now for spending your time and knowledge drop on us, and hopefully the students find a value.
Yeah, good luck with everything.
All
And
right.
no matter what field you choose, you will not regret. I mean, medicine is great in itself, and I feel I'm very blessed
Mm-hmm.
and very rewarding to be a doctor. It doesn't have to be radiation. It can be anything, pediatrician, internist, and all of that field. you make a difference in other people's life, and there are not much career out there that able to do that.
Yeah.
So, yay.
Yeah.